You don't hear much about it, head and neck cancer, but according to the government, it accounts for 3 to 5% of all cancer cases in the United States.
And it affects mostly men and people over 50. And as you may remember, actor Michael Douglas battled stage 4 throat cancer. Earlier this year, the 66-year-old announced the tumor is gone, and he's now in remission.
And since this week is Head and Neck Cancer Awareness Week, we wanted to learn more about this disease and, of course, try to inform you as much as possible. And joining us live on the phone right now is Dr. Kathleen Yaramchuk. She is the chair of the Ear, Nose, and Throat Department at Henry Ford Hospital. Good morning, doctor.
Good morning.
I'm curious, right off the bat, what is the thing that you think people need to know most about this cancer with head and neck, because we don't hear that much about it?
I think you have to be aware that anybody can get this type of problem. For many years it was associated with people that smoked, and there's no question that people that do smoke are at a much higher risk of developing a cancer of the head and neck than others. But we're also seeing that it's starting to affect people that are much younger, and it can be men, it can be women, and it can be people that don't have any smoking history at all.
What are some of the symptoms? Because, you know, when you think about breast cancer, you're often talking about self-exams, looking for lumps and that kind of thing. What are the symptoms for head and neck cancers?
The most common symptoms are a lump or a bump, usually in the neck. It can be on the face, and it can also be in the oral cavity. The whole idea of Head and Neck Cancer Awareness Week actually began in 1984, and it was with Yul Brenner. And what they say now is to check for head and neck cancer, all you really have to do is open your mouth. And an ear, nose, and throat physician can see you, do a thorough exam of your neck and the oral cavity and your throat, and can certainly make a diagnosis. And if you have any concerns at all, spitting up blood, ulcers in the mouth that don't heal, sores that don't heal, or lumps in the neck, those are things that need to be investigated.
Do you find, doctor, that individuals just kind of say, you know what, I'll get over this, not realizing that this may be a situation that they need to go check out and just say, yeah, well, you know, I've got this, we'll see what happens?
Exactly, and I think we all have had, you know, canker sores or ulcers that are there for a few days or a week and then resolve. If it's anything more than a few weeks, it's something that you need to check out. And the same thing with lumps in the neck. You know, you can get a sore throat, you get a lymph node that swells up, but if it stays there for a period of time, if it's hard, that's something that needs to be investigated and you shouldn't wait on.
Better to be safe than sorry. Get those checks. Dr. Kathleen Yaramchuk, thank you so much for letting us know about Head and Neck Cancer Week and some of the signs people should look out for.
Thank you so much.
Of course, if you'd like more information about Head and Neck Cancer Week or about Henry Ford Hospital's Treatment Center, we do have a link on our homepage on WXYZ.com.